Today's drug is Alprazolam. Brand name, Xanax. The pharmacologic or therapeutic class is a benzodiazepine or hypnotic. Dosage form and strength. The medication comes as a tablet in a 0.25 mg, 0.5 mg, 1 mg, and 2 mg strength. It also comes as an orally disintegrating tablet in a 0.25 mg, 0.5 mg, 1 mg, and 2 mg strength. There is also an extended release tablet that comes in a 0.5 mg, 1 mg, 2 mg, and 3 mg strength. And finally, there is a concentrate that comes in a 1 mg per 1 milliliter strength. Indications and dosing for adults. The first indication is for generalized anxiety disorder. It is for acute treatments. The treatment range is between 0.25 and 0.5 milligrams by mouth 3 times daily. When initiating, start at 0.25 milligrams by mouth 3 times a day. Dose increases are every 3 to 4 days to a max of 4 milligrams per day. The next indication is for panic disorder. Regarding the immediate release dosage form, the treatment range is between 0.5 and 3 milligrams by mouth 3 times a day. When initiating, start at 0.5 milligrams by mouth 3 times daily. Dose increases up to 1 milligram per day every 3 to 4 days. Regarding the extended release dosage form for treating panic disorders, the treatment range is between 3 and 6 milligrams by mouth every day. When initiating, start between 0.5 and 1 milligram by mouth every day. Dose increase by 1 milligram every day every 3 to 4 days. It is important to note for this extended release dosage form, do not crush or chew the ER formulation. There is also an off-label indication in adults for vertigo. When initiating, start at 0.5 milligrams every 8 hours as needed. Indications and dosing for pediatrics. There is an off-label use for anxiety. There is limited data for children 7 years of age and older. The treatment range is between 0.125 and 0.25 milligrams by mouth 3 times daily. Initiate 0.125 milligrams by mouth 3 times a day. Dose increases are 0.125 milligrams per dose every 3 to 4 days with a max of 3.5 milligrams per day. Mechanism of action and pharmacology. Alprazolam increases the inhibitory effect of GABA on neurons, which causes increased neuronal membrane permeability of chloride ions, resulting in a less excitable state of hyperpolarization, which leads to stabilization. There is a binding to postsynaptic GABA neurons at stereospecific benzodiazepine receptors affecting multiple locations of the CNS, such as the limbic system. Effects appear to be linked to GABA A receptors and not the GABA B receptors. The medication is rapidly absorbed. It is hepatically metabolized into 2 active metabolites, as well as 1 inactive metabolite. The metabolism occurs via the CYP3A4 pathway. The medication is excreted in the urine as the unchanged drug as well as the metabolites. The time to peak for the immediate release is between 1 to 2 hours, while the extended release is around 9 hours. It does decrease by 1/3 if taken with a high-fat meal, and it increases by 1/3 if taken 1 hour or after a high-fat meal. The time to peak for the immediate release is between 1 to 2 hours, while the extended release is around 9 hours. The orally disintegrating tablet is between 1.5 and 2 hours. The half-life elimination in adults is around 11.2 hours. The medication is 80% protein-bound, primarily to albumin. Special populations and considerations. In Asian Americans, the max concentration is increased by 15%, and the half-life elimination is increased by 25%. In patients that smoke, the concentration is decreased by 50%. In elderly, when initiating, consider starting at a lower end of the dosing range, as well as lower dose increase tapers. When discontinuing therapy, taper no more than 0.5 milligrams per day every 3 days, and that is in regards to both adults and pediatrics. In patients that are renally impaired, there are no adjustments required. For the hepatically impaired, consider dose frequency and dose strength adjustments. Contraindications and cautions. Avoid abrupt withdrawal. Caution if CNS depression. Caution if alcohol use, history of seizures. Caution in depression and changes in smoking habits, as well as if elderly or debilitated. Regarding pregnancy, consider alternatives. There is a risk of teratogenicity, neonatal withdrawal, and floppy infant syndrome. Regarding lactation, there is limited data. It may be considered for short-term use, but monitor the infant closely due to the risk of CNS depression. Side effects. Some common side effects are hypotension, dizziness, irritability, impaired coordination, libido changes, and menstrual irregularities. Some serious side effects are seizures, dependency, abuse and misuse, tachycardia, syncope, and angioedema. There are several black box warnings. The first is using the medication with opioids. The second is the risk for addiction, abuse, and misuse. And the third is the risk of dependence and withdrawal reactions. Drug interactions. Some considerations for drug interactions are CYP3A4 substrate inhibitors, CNS depression, and hypotensive effects. Some contraindicated drugs are atazanavir, clarithromycin, ketoconazole, as well as others. Some drugs of note are amiodarone, buprenorphine, cat's claw, cimetidine, amitriptyline, cetirizine, citalopram, as well as others. Monitoring parameters. Monitor for signs and symptoms of abuse, misuse, and addiction. Monitor LFTs if there is prolonged use. Patient counseling information. Alprazolam is used to treat anxiety disorders, anxiety caused by depression, and panic disorders. Extended release tablets are intended to be taken whole and are not to be broken, crushed, or chewed. If a dose is missed, take it as soon as you can, unless it is almost time for the next dose. The medication can slow or stop breathing if recently used with an opioid, alcohol, or other drugs that can slow breathing. You should not take alprazolam if taking ketoconazole or if you have a breathing problem such as COPD or sleep apnea. Also, do not take if the patient has drug or alcohol addiction or suicidal thoughts or behaviors.